Good morning, everyone. Your time right now is 5:39. It's a difficult topic to talk about, but suicide is the third leading cause of death for 10 to 14-year-olds.
In this week's edition of Better Health, we're sitting down with Asante Health expert Beth Coker and Dr. Stephen Hubbard to discuss youth suicide.
Suicide is a large and growing problem in our country, especially among young people aged 15 to 24. Who plays a role in recognizing the warning signs of suicide?
Well, everyone does. I mean, family, friends, teachers, therapists, medical providers, they all play a role. I can't tell you how many times when kids come to the ER, it's a friend that contacted somebody. You know, a young teen that's hurting and struggling will reach out to a friend and say, you know, I want to kill myself. And boom, if that friend in their goodness will reach out to their parents or somebody and that gets the help that they need and probably save their lives.
So how can someone help prevent a suicide?
Well, notice the signs, particularly depression, a lot of anxiety, withdrawal, those kind of things are very important. You know, ask questions. You know, it doesn't hurt to ask, hey, how are you feeling? Do you ever feel like killing yourself? Take any threats seriously. If somebody says I'm going to kill myself or I'm thinking about killing myself, then you need to heed those warning signs and take it seriously. And get them the help, they need, you know, and listen to them. And then, you know, some of the basic things you can do, if once you suspect, you can limit access is important, you know, lock up firearms, medications, make sure medications get locked up. Even stuff like Tylenol, ibuprofen can be dangerous. Sharp objects. Sometimes kids use, you know, will try alcohol, poisons, bleach, and it may not kill them, but it can also damage them. I mean, that's just can be really bad as well. They damage themselves permanently for life.
So what I hear you saying is talk about it, ask questions.
Correct.
Why are people so reticent to have this conversation? Is there a stigma attached with suicide?
I think in mental health in general, there's a stigma. You know, you're weak if you're depressed, you're weak if you're anxious, if you're struggling inside, you're weak.
So what is the kind of aftercare? Someone attempts a suicide and hopefully it's not successful. What kind of aftercare do we offer them?
Well, first, you know, they'll usually go to the emergency room because, you know, this is a dangerous threat and they might do it again. From there, they'll either be hospitalized or be sent home. Once they're sent home, there's a number of things you can do. First of all, safety planning. Usually the hospital will do that before any hospital will do that before your discharge. You'll go through specific things, what to do if you start feeling this way. Teens can sometimes be impulsive in their suicide attempts. You know, observation is huge. You know, if you can keep them under close observation for 3-4 days, make sure nothing else is going to happen, and then limit their access. You know,
So
like I talked about before.
Watching this Better Health segment this morning and they're thinking about suicide, they should talk to someone. You would encourage them to talk to someone.
Absolutely get help. I mean, the power of therapy is huge. I mean, if you're seeing a therapist every week, your chances of killing yourself drops tremendously. So I think that's a huge help factor. Getting, you know, seeking psychiatric care can be very helpful.
And is there a hotline that a person could call?
Absolutely. There's the hotline that's on the screen. And Jackson County Mental Health has their own hotline. Most counties run their own 24-hour hotline because, you know, we want to keep kids from doing this.
So a lot of agencies out there ready to help people who are really struggling.
Oh, absolutely, absolutely.
Thank you so much.
Thank you both for being here. We'll be right back.